Yesterday on Halton News, we presented a story in which Dr. Galange outlined how much more prevalent the measles are here in Ontario this year compared to previous years and the importance of prevention through vaccine. Today, the focus is on what to do if you or your child are showing signs of this extremely contagious condition.
The majority of cases, or most people who get measles, end up not being extremely ill. It's usually more kind of mild to moderate illness. This can look like things like pink eye, cough, nasal congestion, fever. Then there's the characteristic measles rash, which is that red rash that starts on your face and then moves its way downwards over time. And that's most cases. However, there is a population that's not insignificant. So in Ontario, for example, about 1 in 10 children who get measles end up having to go to the hospital. It can present more seriously. So the infection can sometimes move to somebody's lungs and you can develop pneumonia. It can go to the brain and cause inflammation of the brain. Some individuals might become deaf afterwards, blind, and some actually die from it as well. So it is one of those things that can be quite serious. And with measles, something that is unique with measles is that it is actually one of the most contagious infectious diseases we've ever seen. If you had measles and there were 10 of us standing around you without immunization, 9 of us will probably get measles from you. So it's extremely contagious. And like we said earlier, the vaccine is just a sure way to prevent you from getting measles and prevent you from getting sick by it.
If you suspect you or your child may have been exposed or are showing signs of the measles, it's important to do your best not to spread it around our community.
So if you or your child or your loved one are worried about symptoms of measles, you're totally right. Stay home and isolate. Like we said, it's very contagious, so it'll be very important to do what we can to prevent it from being spread to others. If you do need to see your physician, which very often you do, just make sure to call in advance to give your physician or your healthcare provider a heads up so they're aware and can make sure they keep you cohorted or separated from other patients who might be vulnerable and going to clinic that day. Also, make sure you contact public health and let us know, because our team will be very diligent to follow up and provide instructions. Maybe you'll qualify. Check your vaccine status. So again, very important to know if you're vaccinated or not. See if you qualify for the post-exposure prophylaxis, and maybe provide other recommendations like isolating and masking. So if you're sick, stay at home, keep isolated. If you're very unwell, absolutely seek medical attention right away. Contact your physician or your healthcare provider before seeing them, and follow public health guidance.
Post-exposure prophylaxis is available for some individuals here in Halton, but time is of the essence.
For the post-exposure prophylaxis, we call it, is if someone's exposed to measles who isn't protected, or let's say they haven't had measles in the past, because you're protected lifelong if you've had it, or you haven't been vaccinated for it, you can develop measles. And there's a very, very short specific window between when you're exposed to when you get measles that public health can get you to get a vaccine of measles to prevent you from actually developing measles, or something called an immunoglobulin, which is kind of like a very expensive kind of alternative to vaccines. But there's a very limited window, so it's usually up to 3 days for vaccine and between 3 and 6 days for immunoglobulin. So that's part of one of the large things that we do here in public health, so I'm really glad you asked about that, is our team is very diligent to reach out immediately if we hear of any exposures and see who might not be immunized and might benefit from post-exposure prophylaxis with a vaccine.
For more information, visit halton.ca and search measles. For Halton News, I'm Jessica Kaitting.